rural health these days is difficult. I appreciate William Newton and what they've done, not only for Winfield, but for Cowley County and the surrounding area for us folks out in the country. It all occurred on June the 13th, the early morning hours of June the 13th. I had a couple of episodes at home. Didn't really know if it was heart attack, heart related, or some other condition. But in about 8 o'clock I had another issue at home, and my wife decided it was time to come to the emergency room over here and get things checked out, which is exactly what we did. Drove over from Cedar Vale, which is where we live, on a ranch, a cattle ranch outside of Cedar Vale. So it took us about 40 minutes to get here. It was uneventful. Thank goodness they got me checked into the emergency room. And while at the emergency room, laying in one of the beds there, I had a major heart attack. And from there, the rest is history, as they say. As it turns out, Dr. Beard's team was in place for scheduled procedures that day, and was right there ready to save my life, basically. So I'm very grateful how it all came together.
When it comes to the heart muscle, time is muscle, and the quicker you can get to them, get to the cath lab, get the artery opened up and stented, the more heart muscle you can save. There's been certain patients come in with cardiac event, heart attacks, and we can catch them in time if they have changes on the EKG. I personally page or call or talk to Dr. Beard, who then comes down here to the ER, and we can rapidly get them to the cath lab. I think our record is 18 minutes.
A big advantage of this particular hospital is that we all work together very closely. We all know each other. We're on a professional basis, but first name basis as well. We have each other's cell phone numbers. We're able to, I think, communicate very quickly, very efficiently with one another. For example, when people come in the emergency room, I have worked with all of the doctors that are there very often and for a while now, and so we are very much able to quickly talk to one another and help triage and make decisions in a quick, efficient way.
Nothing really showed with the initial checks of what my heart was doing, but once I had the major heart attack, they hooked me back up to the monitor and found out exactly what was going on. At which time, I think, Dr. Beard and his team was summoned from their room where they were prepping to do the scheduled procedures, like I said. And from what I can recall, based on what Dr. Beard was instructing everybody to do, they got me ready for the procedure in the operating room. Thanks to their good judgment, for me to just stay put there in the ER for a while, where they could monitor me and check me out. They did a good job of that and got me hooked back up to the equipment real quick once I started having a heart attack. It was fantastic and just great caregivers.
I was glad to be on staff the day that Donald came in to see us. I'm glad that he listened to his symptoms and he came in to see us when he did. We were very fortunate to have Dr. Beard on staff. We were able to get him to the cath lab very quickly, get him taken care of, and I've heard he's doing well.
I was very proud of our team, starting with the emergency room and identifying the problem quickly, our cath lab team, and moving very efficiently, and the outcome that we had, I think, was really great and good for the patient.
Well, I feel good. I've resumed my normal activities, except working outside in the afternoons in this extreme heat. I've been advised not to do that. Dr. Beard informed me that at my age I have nothing to prove to anybody anymore, so taking it a little bit easier, but he also advised me that exercise was good, to get out and kind of do what I normally do, just do not overdo things.
I think that we have done a very good job here establishing a program that is comprehensive for the management of the majority of cardiac conditions. And so I really like to think that the things that we are capable of doing here, that we do just as well or better than anywhere else. And so both in terms of procedures, diagnostic testing, diagnostic imaging, we've been working really hard for the past few years now, and that we're really starting to see the benefits.